What is up, my podcast listeners? This is your host, Rafael Majaszewski, and I'm going to get right into it because what I want to talk about today is nerve pain. If I had to guess, almost every single person that I work with in person deals with some sort of nerve pain. Now, I'm not going to get into the nitty gritty of how nerves work, but I like teaching anatomy from more of a functional standpoint. I think my biggest beef with anatomy in general is that a lot of people will teach it where you need to memorize it and spit the information back out to them. But there's no real emphasis on how it works in a, you can call it functional way, but in everyday life. I find that a lot of people who I see are looking for answers. And the one thing I've been really kind of thinking about lately is why do I tend to understand where people are coming from an injury standpoint, and how am I communicating with my clients to give them some clarity? Because the people that come see me have already seen a physical therapist, a chiropractor, a massage therapist, and the biggest trend that I see with all of this is that a lot of people don't get educated enough where they understand their own injury. And they're bouncing from one practitioner to the next, hoping for that, but they don't really have any idea. And it's really strange to me that these practitioners are not doing that job. Maybe they're in that state of mind of like, okay, I'm just going to get this person feeling better. I'm going to do this treatment and that treatment. And maybe I'll explain a little bit, but I think there's a disconnect of how professionals in this industry, both fitness and in medical side of things, don't have a clear understanding how to communicate to the person in front of them who is vulnerable, who is looking for answers, who is frustrated, and they just want to get better. Now, auditing on what I do, I always look back to my assessment. And it's also crazy to me that a lot of the people I see have seen other trainers before. All of them have had an experience with a trainer before. And one of the questions I always ask is, have you had an assessment done? And there's two options or two outcomes that I always get. Number one is they never had an assessment. They just started training, which is like really crazy to me. And number two is that they've had a fitness test where they're either performing a cardiovascular test, like I'm going to go on this bike and cycle for 5 miles as fast as possible, or there's a strength component where they do like max push-ups. Now I'm like, okay, that's great. What do those two things tell you? You're bad at cycling and you're bad at push-ups. But I don't know enough about the human in front of me if their shoulder can actually move through internal and external rotation, because that's going to dictate the exercises that I pick for this individual. But a lot of trainers just kind of go into it blindly. They're going to use a program that they use for every single every client that they have already. Maybe it's even the own program that they do, and they put their goals upon their clients. And I just don't know how you make someone better in those scenarios. And no wonder people feel frustrated. No wonder clients and people who are dealing with an injury feel like they're not going anywhere and they're spinning in circles. So when I take a client through an assessment, they're almost shocked to learn so much, because when I take someone through an FRA, I'm looking at the capacity of every single joint that they have, and they can feel the deficiency when I ask them to do something actively. And I will get back to my original point of this podcast episode about nerve pain, but it's vital to understand that everything starts with an assessment. It's no different than if you go to a medical doctor and they check your blood pressure because you feel like it might be low or high, right? Imagine if the doctor never checked your blood pressure and then prescribed some sort of blood pressure medication, not knowing if it's high or low. Or maybe you don't actually need anything. Maybe it's something else. That's why it's so crazy to me that I see these people come in for the first time and they've never had an assessment done on their body. They don't really understand what their physical therapist or chiropractor is doing, and they're like, I don't know what to do. So once I start seeing the lowest hanging fruit, and I always bring that up, in training from the perspective of training something you're not good at, you're going to see huge outcomes. And in my last podcast episode, I talked about if you never train your legs, it's probably a good idea to train it because you're going to see huge improvements. Like as human beings, we love to do the things that we're good at and then continue doing it because it feels good. No one really likes doing things that are difficult that makes you feel inadequate. You know what I mean? And that's what training is working on the things that you are terrible at. But for some reason, people, when it comes to fitness, they're only going to do the exercises that they're good at. Like you will have that one person always deadlifting, and that person always deadlifting is always doing the same weights. They're always doing the same rep scheme, and they're not getting stronger. Crazy. So once I see what the lowest hanging fruit is from a joint capacity level, then I have this huge blueprint and an idea of where to go. If someone is complaining to me about shoulder pain and their shoulder internal rotation looks like this, then that's going to be one of the first things that I work on before ankle dorsiflexion, or I don't know, they don't have enough wrist extension. I don't know. But it's crazy to me that there's people out there that don't do something like that and they're like, oh, we're going to do shoulder presses today because it's shoulder day. I don't know. But once I do this assessment and I show them like, oh, like do you feel that? And they're like, oh yeah, like I can't believe I can't do that. And that's the biggest thing that I've been seeing is that when I ask people like, oh, how's your shoulders, how's your knees, how's your hips? And they're like, oh, you know, a little tight, it's not too bad. But then when I take them through internal rotation and I get them to feel it actively as well, that's when they realize like, oh, actually I'm a lot worse than I thought. And then they go into a athletic setting where they have to demonstrate something with that shoulder and they don't feel it. They have some sort of compensation pattern to do a press overhead or some shit over here. I don't know what it is. It's not until I give them some sort of feedback of them trying to get just internal rotation, and that's when they realize, oh, okay, maybe it's a lot worse than I thought. And then we can start connecting the dots. Because usually, too, when I see a shoulder that doesn't move that well on one side, the opposite hip also has some stuff. And then I start connecting all these dots for people in the assessment and then start explaining that, yeah, maybe when you run, your shoulder and your hip and your opposite toe is the reason why you do this thing that's causing you shin splints. And then they're like, oh my God, no one's ever told me about this. And I'm like, I don't know. I feel like I'm taking crazy pills, that I'm the only person that's given the people who see me clarity, even though they've gone to other people. And then when I start explaining that we're going to work on this thing and this thing and this thing and this thing in order for you to run better or squat better or be able to pick up your kid without your back flaring up, they're like, finally, someone has, figured out my issues. And it's not rocket science, because if something doesn't work in your body, something else is going to compensate. And then that thing gets worse. And then the next thing gets worse. And the next thing and the next thing. And it just continues on. And I know I find the body is quite easy to get better once you have joints that move the way they should. Now, getting back to nerve pain, which, the last 10 minutes I've been just blabbing about something completely different, but it's related. So I'm going to give stories because stories work best, and that's how I teach any of my courses. I had this woman come in where she complained of nerve pain going from her neck down to her hand. And you have a big bundle of nerves called your brachial plexus that goes from your neck through your shoulder, down your elbow, down your forearm, down to your fingertips. And she's gone to her medical doctor, some physios and chiros, and just hasn't seen any kind of progress. And still has nerve pain, and she's had treatment done and blah, blah, blah. And I'm like, okay, I can't promise that I can fix your nerve pain. But typically, nerves hate being compressed. Nerves need space so then they don't get pissed off and tell you by sending pain signals down your arm. So, in her assessment, her neck did not move well. Her thoracic spine did not move well. Her shoulder blades were stuck on her rib cage. And her shoulder mobility, her internal rotation was this, didn't move. External rotation was this. So I told her, I think if I can make all those things that I just listed move better, meaning giving you more space within the joint, your nerves can probably settle down. After about 6 weeks, training her once a week, giving her homework to do on a daily basis, her symptoms went down by 50%. And that's huge. And she was surprised that she felt this good. And this is where I tell people, like, you just have to find the minimum dose of some sort of stimulus to change the environment of your joint capsule to give you the results you want. And that's the cool thing about Kinstretch is, like, you don't have to do that much. But when you start putting in the minimal effort and you start seeing stuff improve, then your brain kind of switches on and you're like, oh, I want to do more of that. So if it's a matter of space, you doing an exercise that you searched up on YouTube or Instagram that's not Kinstretch specific to you based on an assessment, most likely it's not going to get fixed. These posts of like 3 exercises are going to cure your low back pain is probably not going to work for you because we don't know the whole story. What if your low back has, I don't know, pins in it? What if you had a surgery where they shaved off your disc and then these 3 exercises that some gym bro put together thinking that it's going to fix your back pain and you try it and you actually don't know if it's going to make you better or worse, right? It's kind of crazy to me that the fitness industry is one of those industries where people just assume that they can go search it up on their own and just fix their shit up. But another story I wanted to bring up about nerve pain, about space, is that I had another person come in the other day and she was complaining of nerve pain in her hand going up her forearm. And she said that anytime she goes into wrist extension, it would hurt. So I was like, okay, well, let's go along the trend of the brachial plexus. Let's see if I can give her more space. So we did a little experiment. I got her on her hands and knees and she put her hands down and like right away she's like, I felt that nerve thing. I'm like, okay, great. Not great, but like in my head, I'm like, okay, great. We have now a baseline. Let's open up space. So we did shoulder external rotation, internal rotation, elbow flexion, extension, elbow pronation, supination, wrist extension, flexion. We did a hierarchy of different parameters of how I wanted to influence that anatomy. And at the end of it, I was like, okay, let's go back onto our hands and knees and she was surprised that she couldn't like recreate the nerve symptoms. And she's like, how does that work? And I'm like, I just gave you more space. And going back to my original point, nerves hate being compressed. If I can give more room, they can settle down and they won't reenact the tightness that you'll feel and then that shooting pain of nerve stuff. So I didn't have to teach you, well, this particular muscle that goes from the forearm into the hand that crosses over into the nerve is causing you pain. Because once you also understand that our body is so connected that treating or focusing on one specific muscle might not actually give you the outcome that you're looking for. I find that a lot of people run into this problem where their physio or chiropractor will say that a certain muscle is not firing and you need to train that muscle. But that muscle only works if the joints in the area are able to communicate to your muscle to perform the movement. I feel like a lot of people just run into this wall constantly of like, I've been doing my mini band walks and glute bridges to activate my glutes, but I still have low back pain. But if you look at those people, they most likely don't have enough room in their hip capsule to even do hip extension. So you have to peel back a little bit. And I find that with nerves, the simple solution is give more room. Like, yeah, you can massage the area that hurts where you get the nerve pain and it'll kind of settle, but you're not really fixing the problem where it's coming from. I don't know. I feel like, I don't know, I'm the only one out there, at least in my area, that has figured this out, or I don't know, but hopefully that kind of gave some clarity about what to do about nerve pain. I'm going to finish it there because I can probably just ramble on about random things that bug me. But if you guys have any questions about nerve pain or your injury, feel free to reach out. Add me on Facebook, add me on Instagram, add me on TikTok and LinkedIn and Threads and all those other social media platforms. Make sure you subscribe to my YouTube channel. That's it for me, you guys. Until next time.